What is hepatitis B? Hepatitis is one of those diseases which instantly causes panic in someone when they hear of it. Its notorious reputation exists because it can be very deadly for the person who contracts it. There are 5 different types of hepatitis. There are approximately 257 million people who have chronic hepatitis B, and 71 million people who are living with chronic hepatitis C. Viral hepatitis, on the other hand, results in more than 1 million deaths, according to the World Health Organization. Hepatitis is inflammation of the liver, which usually is caused by a virus, but there are some other reasons for it as well. Alcohol, certain drugs and medications, toxins also result in hepatitis. Autoimmune hepatitis is when the body produces antibodies that specifically target your liver tissues. The Hepatitis B virus causes hepatitis B. It may be chronic in some cases, meaning that it lasts as long as 6 months. In some cases, though, it can develop severe consequences for the person, affecting their liver. It usually occurs in children where the symptoms also show some time before showing up. The most common of those are liver cirrhosis, liver failure, and liver cancer. It mostly affects children and infants. Hepatitis B can also be acute, meaning it lasts less than 6 months and usually affects adults. Vaccines are available to help prevent the disease in humans. If hepatitis B virus has infected you, it is highly likely that you may feel its symptoms much later on. The incubation period is often as long as 4 months. Some of the most apparent symptoms are yellowing of the skin and the white part of the eyes, also known as jaundice, a loss of appetite, abdominal pain, weakness and fatigue, and even nausea and vomiting. The hepatitis B virus is passed from person to person through blood, semen, and other bodily fluids. Your potential exposure to a person who has hepatitis B is dangerous, and you must go to the doctor immediately for proper treatment at the proper time. Unprotected sexual contact with a person who has hepatitis B results in getting the virus. Sharing needles with a person will result in hepatitis B, as well as accidental needle pricks. They can result in one contracting the virus as well. A pregnant woman can pass the virus onto her child. However, immediately vaccinating the child will help lower risks of the disease developing. Chronic hepatitis B appears after a minimum of 6 months. During all this time, the virus grows in strength and affects the liver in multiple ways. Liver cirrhosis is the permanent scarring of the liver, which also disrupts the normal functioning of the liver. Liver cancer can also occur due to chronic hepatitis B. Liver failure is when the liver shuts down, and as a result of this, vital functions are also affected. The kidneys may also be affected by this, and the blood vessels may also get affected. Prevention includes giving the vaccine to newborns, children, and adolescents as early as possible. Not sharing needles and not doing illegal drugs is one vital precaution that can save one from this deadly disease. Before traveling to countries that may have hepatitis, consult your doctor so that they can guide you on how to protect yourself from the disease. Before getting any tattoos or piercings, make sure you go to a reliable place.